Hi, this is Ashley with the International Sports Pharmacist Network at sportspharmacist.org. Today I have Dr. Jamie Wilkey joining me. She is certified in pharmacogenomics, and she's going to tell us more about how we can incorporate that as sports pharmacists. Welcome, Dr. Wilkey.
Thank you, Ashley. I'm so glad to be talking to you about this today.
Would you mind giving us just a brief introduction of how you got interested in this and how you transitioned your career into pharmacogenomics?
Oh yes, my pleasure. So I spent 10 years at Walgreens as a traditional pharmacist, as so many pharmacists do. But I felt the pull to move into personalized medicine and to serve my patients in a way that felt a lot more meaningful by not only medicating them, but now to give them the right medicine at the right dose for their genetic profile. And by the time I finished that certification, I felt absolutely on fire and felt like I needed to shout from the rooftops what amazing technology this is and how we as a profession need to embrace this to go forward boldly into the future.
For those of us who don't know, would you mind giving us a little definition of what pharmacogenomics is?
Oh, sure. So pharmacogenomics is just kind of a deep dive into pharmacokinetics and pharmacodynamics. It's just understanding by looking at a patient's DNA how they process their medication so we can give them the right medication for their DNA. So they're not getting extra side effects, safety concerns, and it saves everyone money when you get the right dose at the right of the right medication for the individual patient. It basically takes most of the guesswork out of prescribing, which is pretty amazing.
Right, right. It seems like it would save a lot of time in going through, that process of trying to figure out how you respond as an individual to the medication. So it really seems to make sense to do that up front. If you can talk a little bit about what you do in pharmacogenomics that distinguishes it from those commercially available products.
Oh, yeah, you've been doing your homework. I'm glad you saw that because the FDA did just release the first direct-to-consumer genetic testing or pharmacogenetic testing. The 23andMe company does it. And they look at two specific genes that influence a patient's medication. And so that they have a successful business model doing that means that patients are interested in getting healthier and getting the right medicine for themselves. And so it's really exciting for pharmacists because they can complement that and work with the patients directly to help them understand their results, because patients should not be looking at these results and changing their medication without help from a healthcare provider. And a pharmacist is the best healthcare provider to talk to about pharmacogenetics. Or it could be kind of an introduction into, wow, my genetics do influence my medicine. I'd like to get a complete panel and look at a panel that has over 200 medications to see how that really impacts my life right now and my future. So for me, it's just a sign that they're really interested, and then we can do a deep dive into a much more comprehensive review.
It just sounds like something that could be easily adapted into what sports pharmacists do when they're looking at the whole medication profile for the athlete. And that's where I kind of wanted to go next with our conversation. When we're working with sports, in sports as sports pharmacists, when we sit down with an individual athlete, we do a comprehensive medication review that includes a whole bunch of extra questions like, what is your sport? What is your level of competition? Has anybody given you samples at the gym? What do the trainers use? And so I was wondering, can you tell me what other additional questions you'd ask in doing a comprehensive medication review?
Oh, yes, that's a good question, because PGX should not be like a silo and a standalone science. This should just be considered just like a drug allergy. Like if someone has an allergy to a medication, we would never give them that medicine. This should be considered the same way. If their genetics are not compatible with it, we need to consider that every time we prescribe. And so when I talk with patients, I talk not only about the prescription medications they're taking, but all over-the-counter products, all supplements, everything, because even if there's not a gene drug interaction, there could be a gene drug interaction where we have an inducer or an inhibitor. And so it's so much more than just drug gene. I also ask about their history with medication and how medications worked in the past, especially mental health medication. A lot of people have been on something that doesn't work for them, and they can't exactly say why or what or quantify what went wrong. There's just that it didn't make them feel very good. And so to be able to see their history as well as their current really empowers prescribing for the future and helping them be confident enough to stand up for themselves for the future.
There is a lot of crossover between the two, between sports pharmacy and pharmacogenomics, and I'd love to talk to you a little bit more in depth about this again. Would you mind telling us just a little bit about what the future of pharmacogenomics would look like and how we might incorporate that into sports pharmacy?
Oh yeah, the future of pharmacogenomics is that everyone will have this test and know how to get their prescription medications optimized for their genetic profile. So you're right, sports, high performing athletes have so much control over their body to get to that level. So between their diet, their exercise, all of their supplements are absolutely top of the line. So if they're taking any prescription medication, we need to make sure that is optimized as well. Because small changes can lead to big results. And when you have this knowledge and can use it to help them perform at their highest level mentally and physically, then it's really powerful.
Yeah, and I don't know if you mentioned this already, but it's just a one-time test and it wouldn't change over the time in the way that other pharmacokinetics for an individual might. Is that correct?
Yeah, it's just a one-time test. Your genetics don't change. So maybe in 20 years, technology will be vastly improved, but like your genetics don't change. So it's not like a blood draw where you have to come back every 6 weeks. You just do it once. And for the rest of your life, you know how to be prescribed for. It's absolutely amazing.
Yeah, it's quite fascinating to me for sure. So, and I just wanted to let people know as well, you have a course that's available online. And would you mind letting us know a little bit about that content?
Yes, I would love to. So I successfully created my own consulting practice, and now I created a course to teach other pharmacists how to do that. So if they feel hopeless or stuck or like a slave in their job, then I'd encourage them to check it out to teach them how to create their own consulting job and control of their schedule and their salary.
Excellent. It's so exciting. Well, I'm really glad to talk to you today. There's a lot of topics that I'd like to branch off of and see how else we can incorporate this into sports pharmacy and help our sports pharmacist network along. So if you wouldn't mind joining me another day, I would love to have you back. And I really appreciate your time today.
Yes, we have to talk again, Ashley. This is really fun.
Yeah, and thanks for watching. Please like this video, subscribe, and share.
Thanks.
Thank you very much.